Hello, everyone, and this is your trichologist practitioner, Dr. Leo today. And so, what we're going to talk about today is one of the huge things that everybody's always asking me what the difference is between a trichologist and a dermatologist. So I'm actually a trichologist practitioner. And so the difference is this, is that there is a difference between, so I'm just going to kind of, go through my notes, okay? So it's like a frequently asked question that patients, to help patients with their hair and scalp issues. The difference is dermatologists deal with the skin, we deal with the hair, but we kind of dip into each other lane in a sense. But as far as a dermatologist, if you know that you have a skin issue, then we will have you to go to a dermatologist. We do not deal with skin issues at all. The dermatologists where their expertise are. And a dermatologist, if you have a true hair issue, then they will send you to a trichologist, okay? So that way we kind of look into the underlying issues of what causing the hair to come out, okay? The difference is that a trichologist focuses solely on hair and scalp. A dermatologist is a medical doctor because they deal with prescriptions, and trichologist is more holistic, trained to evaluate, manage patients with benign or malignant disorders of the skin. That's the difference between with the hair, nails, and skin as far as adjacent to the mucous membrane. So that's the difference between the two, is that they are a medical doctor. We are holistic board certified practitioners, to where we don't do anything as far as the benign or malignant of the skin. That's what the dermatologists do. And so that's one of the biggest things that the difference between, okay? So another thing is that dermatologists might listen to the patients for symptoms, but may not always carry out through with the examination of the scalp, while we as trichologists will obtain a full hair history and check the scalp for lesions, pimples, signs of inflammation, damage of the hair follicle. Also using a microscope so further to analyze the hair health, to where a dermatologist would do a biopsy to see what is causing the hair loss. And a trichologist, what we do, we actually do a scan to actually go in depth and see what the hair follicle of where it's at, as far as any damaging, if the pores are open, if the pores are closed. We go more in depth, and you'll be able to see. So if you go to a dermatologist, you're not going to really see the biopsy. They'll actually take a piece off of your scalp and send it to the lab, and to where that way they actually will get results back. So one of the biggest things is this: if someone say, yes, you have alopecia, that is not a diagnosis, you guys, okay? They have to go in specifics of what type of alopecia that you definitely have. Even if you see a trichologist practitioner, they don't tell you what type of alopecia. They did not do a full examination. They did not do a full diagnosis on you. You need to get another opinion, to where someone needs to go in and tell you what type of alopecia, okay? So that is the difference between the two. As far as treatments, okay? As far as treatments, dermatologists, what they do, they usually do ointment. They will actually do blood work on you. That is their job to do that. They will also, if the ointment doesn't work, then they will kind of go in the last results to actually do a steroid shots, okay? That is their last results. If no hair comes back from that, that is pretty much all they would do. They would say, well, it may or may not come back, which it definitely is true. Some things you do have to try to make sure to see if the follicle can be awakened, because sometimes what will happen is underneath the skin, it may look like the follicle is dead, but it is not. It's just that it is dormant, and there is treatments that they would do to see if they can awaken, or as we may say, give it CPR to see if we can awake the hair follicle. What we do is that we actually do a scan. You'll be able to see the actual hair through the scan, and below you actually see where I did one scan, and you can actually see the hair follicle. And what we did, we magnify it to where the scope, what it does, it magnifies to where we actually see one hair at a time, just to see how the hair follicle and the pores open, okay? And we actually will email you these scans so that way you have a record. And then you'll come back in about 3 months, because usually it take maybe up to 90 days for you to see some results. Most people can see some results within about 2 to 3 weeks. Depends on how long they had the alopecia going on, the hair loss going on. So we will actually send those scans to you, and when you come back in about 3 months, we'll do another scan, which that's considered a follow-up. And what that does is that when we do the follow-up, we do another scan, and we actually compare the pictures side by side. Okay, we compare it side by side to see how the before and the 3 months, and you will actually see now on the patient that we had there before and then 3 months after of just seeing the hair growth. And so because they've been doing the treatments that we recommended, we even have a stylist for them. So if you have a hairstylist, we actually go in with them and get them a hair regimen for what they're doing to the salons, which is going more in depth than what a dermatologist does. So we deal with the hairstylist, the styles that they do that may or may not have taken the hair out. We also work closely with your physician. We even work close with your dermatologist. We work closely with your OBGYN. So if you have any underlying issues, some immune system going on, we work closely with them. We look at your blood work, which is their job to get blood work. And then we look at the numbers. We will explain to you what all those numbers represents and how to get your numbers more in line. We deal with all of that of getting to the underlying issues and try to reverse what caused the hair loss. That's the biggest key. So after that, we actually go in and we deal with nutrition, especially if you're overweight and you have a lot of fat cells that's clogging up the pores. We actually give you an actual nutrition plan. Some people have a trainer. We work closely with their trainer and recommend some things of what they have to take out of their nutrition. That way they can lose the weight, and then as they lose the weight, a lot of the medication they was on, they're off. A lot of times your BMI goes down, so then that way then the pores open up on its own as your BMI goes down, because there's no clogging, no fat cells that is around that pore that overlaps. Also, we actually deal with vitamins that you're taking, what type of vitamins are good, some type of vitamins that's not good. Of course, we talked about hormones. We talked about the age that you are, trying to reverse some things. When it's hereditary, that's a little different. That takes a while for hereditary kicks in, okay? Everybody talk about the age of when you go through menopause. They're hereditary as far as my hair coming out. Menopause is not dealing with hereditary. Everybody go through menopause with that, okay? But when something is hereditary, that is beyond any immune system going on. That is that DNA at that particular time that's active. And then it's called androgenetic alopecia at that particular point. A lot of times the hair still can grow back. Just that you have to do things a little different from how you was raised to kind of get the hair to grow back. So that way that hereditary of that habit is not implemented into your life. And that's how you reverse some things that people may say that's hereditary. Some things are just habitary, if that's a word you want to call it. So that's the difference between a trichologist and a dermatologist, that they pretty much do a biopsy, we do a scan, but we do a whole body analysis, okay? We even do metabolic analysis, and what that does, that is dealing with your BMI, that is also dealing with your skeletal muscles, how strong your muscles around your bones are. We also tackle your blood type testing to see what your blood type is. That way you can eat foods that is great for your blood type. That way your digestive system can definitely digest the food a lot better. Another form of what we do here in the clinic is that the metabolic analysis, also deal with the age of your body. That's a big shocker for a lot of people. They could be age 22 but have a body of a 42-year-old just because of their body structure and what all they're doing with the body. And we can actually reverse those things, okay? Also with arthritis, we work closely with your physician with that. That way we can kind of get that movement together. Some things that your physician would do, some things that we would have you to do, some holistic things that would tone down any of the arthritis. Just a little nugget, just with arthritis, if you do turmeric, or if you also do cayenne pepper, those things are inflammation and helps with joints. So that way that can ease the pain of that while you continue to get the weight off that causes the joint pains, okay? So we talk about all of those things that will kind of help holistically to kind of get your body back aligned. Okay, so hopefully this helps. Share, like, subscribe to this video, to my channel. So hopefully this helps you guys. So if you have any questions, leave it in the comment section. So that way my information is also all in the description. So hopefully you guys help. You will see all the photos of before and after, the difference between dermatologist and trichologist. So again, this is Dr. Leola Day. Hope you guys help you guys with the information of knowing who to book, when to book as a patient to get you on the right track. So hope this guys help you guys, and you guys have a good day. I'll talk to you later. Bye bye.